Neck rejuvenation, fine lines and a little loose skin. I also have a line all the way around the lower part when looking straight ahead. It worries me that the texture is not as good as my face.
Thank you for your question. You submitted your question with a photo of the lower part of your face, and you express a concern about the appearance of the lower part of your face, or actually more of the neck area, as not matching the way the face appears, and you're concerned about some fine lines and some loose skin. Well, I can certainly share with you the type of discussion I have with my patients when we talk about this area, which is of significant concern to pretty much everyone who has any history of sun exposure or is dealing with the natural progression of facial aging. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people rejuvenate their necks is a very big part of what I do every day in my practice. So I explain to my patients the way to prioritize or to actually understand what is the approach to helping the neck as opposed to improving the face. There's a few things that we also want, a principle that we also want to emphasize. A lot of times people will see a disconnect between the facial appearance and the neck appearance, and what is often is referred to as the giveaway, what a person's neck or hands look like versus the appearance of their face. So what you want is a harmonious balance and improvement. When it comes to the neck, there are several things that are much more challenging. One is the difference in the actual skin texture and quality compared to the face. The neck doesn't have as many oil and sweat glands compared to the face, and the skin of the neck is extremely thin. That, combined with laxity or looseness of the skin and the activity and behavior of a muscle called the platysma muscle. So when it comes to rejuvenation of the neck, we first want to decide, is there enough sagging that there needs to be lifting? Now there's a distinction here. When people look at their necks, a lot of women look at their necks particularly, they'll pull back and say, look, it looks so much better. And even though that may be true, it's not because there's a lot of loose skin, but rather because the skin quality has diminished. So anything that is getting thinner and more rippled, when you pull on it, will naturally look better. But if you were to surgically try to correct that, the tissue is so thin and so weak that there's going to be a significant amount of regression, and that would be a challenge in justifying the procedure. So when it comes to helping people with their neck, if there is enough laxity, then we do something called a neck lift, or it's often combined as part of a facelift to do a face and neck lift. Now that's one surgical option. The non-surgical options, which are also done in conjunction, it's not one or the other, but non-surgical options are more about texture and quality of the skin. And everything from doing a procedure such as the use of platelet-rich plasma, whether it's injections under the skin or what we refer to as intradermal injections, which is within the skin, to help the quality of the skin. Platelet-rich plasma is derived from your own blood, and it's a concentration of the wound healing and growth factors that stimulate collagen and restore blood supply. It's something that does help improve neck skin quality and texture. Further, we also employ different types of lasers, and what we've been doing a lot of is the use of something called a Q-switch laser to treat the neck skin in a way that's referred to as laser toning. And this is using a certain wavelength and time and energy into the skin to stimulate what's a remodeling of the skin quality so that the lines and fine textural issues are improved. Topical treatments can include everything from glycolic acids and something like hydrofacial to the use of topical retinols that can be used at home. Basically, there are more than a few options, but I would say that if you have more of a textural issue as opposed to a sagging issue, then discuss with your doctor the strategy, because frankly a lot of times people will be disappointed if they only do one thing at one time. Usually for skin textural improvement, I describe it as being comparable to exercise or gaining muscle. You stimulate, you wait for the body to respond, and then you stimulate further. So very often there's a strategy of a different treatments done at different time frames towards a particular endpoint. And of course there are different lasers that can be employed. You don't have just one laser. You can do two different types of lasers applied for different reasons to help improve the skin quality and texture. I believe in a synergistic approach. I think that the concept of regenerative medicine using platelet-rich plasma is very valuable to maximize your body's response to any treatment done with a laser. There's also microneedling and different ways to also deliver hyaluronic acid and PRP through a microneedling type device. So as you can imagine, yes, there are many options for you, and you have to figure out with your doctor what makes the most sense. And of course, I believe very strongly in photo documentation. Texture is sometimes very, very difficult to really show with photos, but it is worthwhile to understand what kind of outcome you can expect, so you'll be able to appreciate the change over the course of your treatments. So I hope that was helpful. I wish you the best of luck. Thank you for your question.